Good afternoon. Thank you all for being here. Welcome to What's New in Gut Health. Today, our goal is to empower you to make a difference in the lives of the people that you serve. As health ministers, you are trusted members of your community. People often share personal concerns with someone they know and trust before making an appointment with a healthcare provider. Some of the diseases that we will discuss today regarding gut health you may or may not have heard of, but our goal is to teach you to not to diagnose those diseases. However, our goal is to teach you to recognize warning signs, respond with compassion, and refer people in the right direction. So remember, you're not supposed to know everything about the diseases, and you're not supposed to diagnose these diseases in people, but you should be able to recognize that they may be concerning and that they should talk to someone and seek care. Throughout today's presentation, remember these three words: recognize, respond, and refer. You will hear those three words throughout the presentation, and it's so important when you're working with your congregation. So let's open up the floor with a question. Why do people often speak with someone from church before speaking with a healthcare provider? And anyone can feel free to jump in.
Generally, that's because they feel more comfortable with someone they already know and have a relationship with.
I also think that there's a level of trust with someone they know, as opposed to for some reason, some of it I talk to my church members, they are really just afraid and just don't have a lot of trust. And so they will, a lot of times, will come to me, with some questions. So I think it's a
Right.
level of trust too.
Both of those are so true, so true. Just that trust factor. Most of us, we've been in church our entire lives, most of the congregation, they know the people that are in the congregation, they feel safe, they feel like they're supported, and they know that they will have just not that encouragement, but they'll also have that spiritual support too, that often goes hand in hand with physical health in our community. So, what's the purpose of this program? The goal of the program today is to discuss digestive diseases. So, digestive diseases affect millions of Americans, yet many people delay care because of embarrassment, lack of awareness, transportation, cost, or difficulty assessing specialists. Black communities have historically experienced barriers to timely care. However, churches are trusted community partners, as you mentioned earlier, and together we can improve health. And that's where you all come in as health ministers to help improve health in the church. So, what barriers to healthcare do members of your congregations face? Any thoughts on that? What barriers do some of the members of your congregations come to you all and say, hey, we did not go to the doctor because, or we would like to go to the doctor, but?
Could be transportation.
Right.
It could be money, tests that they might be ordered and they know they cannot afford them, especially the insurance is not going to pay for tests that they need. And a lot of it is fear also.
I
What
agree. I agree.
what I've been hearing lately is I want to make a doctor's appointment, but I can't get in to a provider. It's going to be months down the line before I can even get to a doctor to even see what's going on with me.
And it's been hard for people to stay with one doctor, especially if they're going to public facilities that change residencies. And every time they go to the doctor, they're seeing a different doctor. And every doctor have their own plan, although they do have a skeletal plan that they use, but some may use one drug other than, and another may use a different type, but may still work on the same function, but it's just totally different drugs. And that could be an issue.
For sure. All of those things. Transportation, that's a big one. If you have to catch the bus, sometimes multiple buses, it's hot. There's Medicaid, they offer transportation, but as we know, that you have to wait. Sometimes you have to get to the appointment 2 or 3 hours early. You might have to wait 2 or 3 hours later to get picked up. Costs, you don't know how much it will cost, even if you have health insurance, you have deductibles. It's like you said, the wait, who knows how long. Sometimes the appointment wait can be weeks, months, and you have something that you need to see get taken care of now. And that's why many patients sometimes go to the emergency room instead of going to the doctor first. And then if it's not emergent, they're told to go to their doctor, but they can't get in. So it just creates this this cycle. And then many times, like you said, there's fear where we get frustrated and we may not go at all. And then sometimes if we really think it's something bad, we're afraid to go because we don't want to hear something bad. Like we have bad news all around us. The last thing we need to hear is, oh, this may be blank, or this may be cancer, or this may be this, even when it may not be. We just don't even want to deal with that concern or that possibility. So all of those things are definitely valid reasons of why many people do not seek health care when they should. So as a health minister, what is your role? Your ministry is to care for the whole person, body, mind, and spirit. You're not expected to diagnose illness. You're not a provider or a physician, so you shouldn't diagnose, but you are a trusted voice and you're there to listen. You're there to listen first, to encourage care, to reduce stigma, and to connect people to resources. How can a caring conversation influence someone's decision to seek care? What are your thoughts on that?
Well, we can definitely keep encouraging them to let them know that the earlier you find out an issue, the better chances of recovering from it. Don't wait until it's real bad, then you may not have options.
I agree. And has anyone had to influence a member of their church to seek medical care?
Yes, 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 I have. This was a very dear church member who had been told that she needed to have a colonoscopy done, but she was afraid. We talked and we talked and we talked until I was literally purple in the face to ask her to please go and have your colonoscopy done. Well, unfortunately, she had colon cancer. But she's so thankful for me for even insisting that she went when she went, because possibly her outcomes would not be good. And I'm glad to say that even though it's been over 5 years now, she is doing extremely well. So
That's
she every time she sees me, she will thank me, just so much for just insisting that she please go.
That's awesome. That's awesome. And we've heard stories like that so many times of people that's afraid or they just don't want to go. And I just tell people, don't give up. Keep encouraging them, keep motivating them, even if it takes, hey, do you want someone to go with you? Like, can I come with you? As a church member, often, we want to help. And even if you can't go because maybe you have to work, maybe someone else in the church or someone that, maybe that's retired, they can take that person or go with that person, because sometimes you just don't want to go by yourself, or you may not have that family member or loved one to go with. So it's important to just keep encouraging, keep listening and encouraging. And it's tough, but don't encourage, but and gently. Don't be like, well, you need to go to the doctor. I keep saying you need to go to the doctor because that doesn't help as well if you're too rough, but just that encouraging and being gentle with that person. So why does gut health matter? In this area, especially New Orleans, we know that food is a big part of our culture and our bodies need to be able to process that food. So that's why gut health matters. Our digestive system helps us digest food, absorb nutrients, and ultimately stay healthy. However, if we have a digestive disease, it can affect nutrition, energy, work, family life, and emotional well being. The encouraging news is that many GI diseases are very treatable when diagnosed early. So, in discussion, what digestive concerns or conditions have you heard discussed most often? Like, what are some digestive diseases or GI diseases or conditions that you often hear about?
IBS,
Constipation, severe constipation,
Right.
diarrhea.
That's diarrhea. Right. Reflux. I know many
Oh
people.
Lord, yes, reflux, yes.
That's a big one. Reflux,
Yes.
GERD, heartburn, um, like you mentioned, the IBS, the irritable bowel. And sometimes people don't really know the
What it is.
terms, call it, but they may say, like you mentioned, I have diarrhea, I have constipation. They may just say, they might not even say I have diarrhea. They may just say, I keep running to the bathroom. Because that's kind of embarrassing to say maybe I have diarrhea, I have gas. They may just say, oh, I feel bloated. So those terms are very popular that community church members may come to you and say, I have bloating, or my stomach hurts, or I keep running to the restroom, because they may not know that particular term, but you can recognize, hey, that's a GI illness and you should see someone. So health equity. So as you may know, health outcomes are not always equal across communities. Many Black Americans face barriers to healthcare, including limited access to specialists, transportation challenges, cost issues, and just the historical mistrust of the healthcare system. These barriers often delay diagnosis and treatment, allowing diseases like inflammatory bowel disease to become more severe before care begins. So, this is where the church can come in and help. Churches have long been trusted as community centers of education and support. By encouraging people to seek care when symptoms first appear, health ministers can help reduce delays and improve health outcomes. So, this is one of the most important ways your ministry can make a difference. Any thoughts on that?
I agree. I
I
agree.
agree with that. That's all.
Yeah,
I really agree with that.
Right.
because it's very important. It's more important than people think it is.
It is. And just any thoughts on just how the church plays a role in, I think sometimes we take it for granted, just the power of the church.
Yeah.
But I feel like if the church can move, and we're already there, but if we can, like you all are already there because you're here, but just if more churches can move into that just health focus as well, because that's important, just mind, body, soul, but our health
Hmm.
is so important. And the church is such a powerful tool and we're so instrumental in just education.
Mm-hmm. But I do think the churches still need a lot of changes as well, because although we are the centerpiece of trying to bring them all together,
Right.
even when you look at our functions, what do we having at our functions? We having
Right.
things that's fried. We having things
Donuts.
processed. We having things that
Donuts.
we don't supposed to have. But now we have to make them understand. Hey, we know sometime we're gonna eat this, but
Right.
we are in the habit of eating it so many sometimes.
Yeah, I think that is so true because I frequently tell anyone who's planning any type of menu to please talk to me first. Give me. I don't want to, you know, and you always have to tell them this. Y'all, we have to move away from our habits.
Right.
My congregation is getting older. I mean, basically we old. Okay, we old, and we cannot do what we used to do. We don't move as much as we used to move. So I cannot give you all donuts. I cannot
Right.
give you all fried chicken. I need
Right.
they need an option.
And
Can
they
you bake
love
a piece
those
of chicken?
things.
Oh, we do need that.
And I think we all do, but
Right.
it's our job to keep trying to say, well,
Right.
it's not really good for you. And I'm
So
telling you, it's just, we need to make some changes.
Right.
Just
yeah,
just some changes. Let's eat some
and
fresh fruit for change for a change.
I agree. I agree.
and
It
just
begins with the church. I'm
giving
sorry.
them options, giving them more options other than just the fried, more baked fish, more,
Yeah.
and not just always going to our regular go-to items, but
Right.
introducing other items so they can actually get used to it. Because some people
You can try
they
it.
don't even they don't even try. Let's do some steamed vegetables instead
Right.
of cooking all of the nutrients
Oil.
out of them by boiling them.
Yeah.
Yeah.
Things like that to help try to move them towards a more healthier diet and not just all of a sudden just taking everything away
Right.
and
Yeah, they ain't gonna do that one good.
It takes
You have
time.
Options.
to ease them. You have to ease it
Options.
in.
Ease a bit. And that's why we're here today. That's kind of why you all are here. And hopefully this can spread just because knowledge is power. And like you said, it
Yes.
does begin with the church because we do have to practice what we preach.
Yeah.
We can't say, oh, we have to kind of start. We have to start, I guess, demonstrating and being an example. And like you say, replacing the donuts with fruits in the morning, replacing the Kool-Aid or punch with unsweet
All of
tea, fruit infused water, just to start slowly making those changes so that it can improve the health outcomes. Because at the end of the day, that is the goal, to improve quality of life and health outcomes.
That's right. That's right.
So let's start talking about one of the most common digestive conditions there is. And I know someone mentioned that earlier, irritable bowel syndrome. So irritable bowel syndrome, it affects millions of Americans and is one of the most common reasons people seek medical care for digestive symptoms. Yet many people live with symptoms years before talking to a healthcare provider. So irritable bowel affects how the intestines function, but unlike inflammatory bowel disease, it does not cause inflammation or permanent damage. So that's a big distinction from irritable bowel syndrome, and what we'll discuss later, irritable inflammatory bowel disease. So there's IBS and then there's IBD. So this is IBS. So with irritable bowel syndrome, some days you may feel well, while other days you may have significant discomfort. Some days you may have diarrhea, and some days you may have constipation, or some people always have diarrhea, always have constipation. It can come and go, but the big thing, it does not affect the intestines. It does not damage the intestines, but it does hinder your quality of life. It can affect you from being, you may not want to go to social gatherings, church events, or even work because you may have to run to the restroom, or you may have uncomfortable pain. The encouraging news is that irritable bowel syndrome can often be managed successfully. So with diet, lifestyle changes, stress management, medications, you can live a comfortable life. And as a health minister, remember your role isn't to diagnose irritable bowel, but you should be able to recognize those symptoms, to listen, and encourage people to talk to their healthcare provider if they're having those symptoms. So, in your opinion, why do you think so many people wait months or years before talking to a healthcare provider about digestive symptoms, such as the ones caused by irritable bowel syndrome?
I believe that it's embarrassment. People don't like to talk about bathroom issues, not even to the doctor. Sometimes they'll even go to the doctor and fail to even mention the frequency that they're, having to go because of the irritable bowel syndrome.
It's tough. It's never cute to talk about gas, diarrhea, constipation. Too bad we're not like my 2-year-old when it's like, I pooed. It's just not.
For real, for real.
Right, right. It's very embarrassing. It's very just inconvenient. And I've seen many patients just in everyday working in the clinic who you do change your life because friends may be going out to eat, but you're like, I can't go because I may have to pull over and run to the restroom, and they may or may not have a restroom. I think we've all heard of people who are like, do they have a restroom there? Or, I don't know. They're just uncomfortable because they don't know how their body's going to respond. And, stress is a cause. Well, stress can make the condition worse, but we still just shouldn't say, oh, deal with your stress and it'll go away, because that's not the case. So let's take a closer look at what symptoms come with irritable bowel syndrome. So common symptoms include abdominal pain or cramping, bloating, diarrhea, constipation, and then as we discussed earlier, the symptoms may alternate from diarrhea to constipation. So it's important to remember that irritable bowel syndrome, it doesn't look the same in every person. Some people have diarrhea, some people have constipation, some people go back and forth, and then some people, might have had diarrhea in the beginning, but then over time, now they have constipation. So it's one of those things that everyone's different. And even though one person may have different symptoms of the condition, but most people do have the abdominal pain and cramping and changes in their bowel habits. Bloating is also very common, and it can affect just your comfort and daily activities. It's bloating is a big deal, especially as women. If you want to put on your dress to go to church, and sometimes you're like, I can't wear this. Like I'm huge. You can't fit it, and it's concerning because you're like, is it me, or did I eat something, or what's going, like, it's uncomfortable. So these symptoms can worsen during periods of stress or after eating certain foods, but stress does not mean the symptoms are in your head. And it's important to seek medical evaluation because other digestive diseases can produce these symptoms. So which of these symptoms do you think people are most uncomfortable discussing?
The bowel movements.
Diarrhea.
The diarrhea.
It's interesting because even in clinical care, I find that people are more comfortable saying I'm constipated than I have diarrhea. It's like almost everybody at some point, like, I'm constipated. Like they talk about it, but it's like they don't talk about constipation. They don't talk about diarrhea. It's almost like they're okay with saying I don't go compared with saying I go too much.
Right.
So that is very true. That diarrhea is probably one of the one of the more embarrassing symptoms.
Yeah. And you know what, y'all? A lot of people think that it's okay to just go to the bathroom 2 or 3 times a week. I mean, whatever happened to when we go to the bathroom daily? I mean, if we eating right, you going daily. Because I know when I'm eating vegetables, I'm going every day.
And that's a good comment, just because fiber is so important and is one of the things that we all probably are not getting enough fiber on a daily basis, because fiber really encourages it encourages bowel movements and going to the restroom. But then again, sometimes when depending on where someone may be in the spectrum, too much fiber may cause some of these symptoms. So really it's one of those things I always tell people to talk to their provider, feel comfortable talking to their provider to see what is the best diet that they should have or what is normal for them. Because some people, they say they went once a week for their entire life, they go once a week. And other people say they go after every meal. So really it's such a wide range, and it's so important for people to have those conversations with their healthcare providers. And then back to those 3 words that we discussed earlier: recognize, respond, and refer. That is so vital. It's important to recognize, know the symptoms that should never be ignored. Respond, listen without judgment. Avoid saying, oh, it's just stress. Instead, you should say, I'm glad you shared that with me. These symptoms deserve medical attention, and there are treatments that can help. And then always refer. Help connect people with appropriate healthcare providers. And remember, you are encouraging care, not diagnosing disease.
And you
So,
know, as we discuss these 3 words, I mean, I think these 3 words can be used for almost any disease entity that's present, even with heart disease. You know,
I,
the symptoms that they have, and to be able to recognize, to respond, and then to refer. So it's just 3 excellent words to me to
I
always remember for any disease entity.
It is. It really it applies across the board, across the spectrum, to really know when something's just not right, and to
Hmm.
feel comfortable just having that conversation and not diagnosing them, but saying, "Hey, I
Yes.
really think you should talk to someone," and getting them connected with the right people. So this is, let's practice what we've talked about. So let's say a congregant says, "I've had stomach cramps and diarrhea for months. I think it's just stress, so I haven't done anything about it." What would you all do using the recognize, respond, and refer method?
Well, you can say, well, I recognize that your issues are recurring, and that's something that you really do need to talk to your primary doctor with. Do you have a primary doctor, first of all? And if not,
Right.
let me refer you to one.
That's great. That's great. Right. Definitely notice that, hey, they're recurring. They've been there for a while, and that's not normal. And make sure that you respond. But I'm grateful that you share that information with you. And as you mentioned, let me refer you to a primary care doctor if you do not have one. That's so important, because what we don't want to do is just say,
Mm-mm.
oh, that's bad, and walk away. Oh, that's bad. I'm
Yeah.
sorry. Because then it's like, okay, now I know it's bad and I don't know what to do about it. So we definitely want to get them pointed in the right direction. So we talked about irritable bowel disease. Let's move on to inflammatory bowel disease. So inflammatory bowel disease is a little more severe. It's not just a stomach problem. It's a chronic autoimmune disease in which the body's immune system attacks the digestive tract, causing ongoing inflammation. And there are 2 main types of inflammatory bowel disease: Crohn's disease, which can affect any part of the digestive tract from the mouth to the anus, or there's also ulcerative colitis, which affects only the large intestine, which is the colon and the rectum. So, unlike irritable bowel disease, inflammatory bowel disease causes inflammation that can damage the intestines if left untreated. And without treatment, it can lead to hospitalization, more complications, and surgery. The good news is that treatments have improved dramatically, and many people with inflammatory bowel disease live active, healthy lives when diagnosed early and managed appropriately. So, before today, have any of you heard of Crohn's disease or ulcerative colitis, which some people say
Hmm.
UC? So, most of us, we know at least one person who have suffered with Crohn's disease or ulcerative colitis, and That's a big deal. That definitely can be life changing. People are diagnosed, I know, children all the way up to seniors and adults. So it's definitely something that is pretty severe, and it's important that we do want to get those members to the appropriate people ASAP if they have symptoms. So let's talk about what are the symptoms of inflammatory bowel disease. So symptoms vary from person to person. However, persistent diarrhea lasting several weeks should never be ignored. So this is
Mhm.
diarrhea that just doesn't stop.
Mm,
Like you have diarrhea for a while, diarrhea, diarrhea, diarrhea. Blood and stool, that's never normal. Blood and stool is never normal.
Mm-mm.
So that's always a reason to have further evaluation. And just assuming, oh, it's probably hemorrhoids, that's not
Mm-mm.
okay. They should still be referred for further evaluation. Abdominal pain, that's severe, persistent, that's a symptom of inflammatory bowel disease. Fatigue, feeling tired all the time, weight loss, urgent bowel movements. So with these symptoms, they're just not contained to the gut. You have some more of
Mm-mm.
those fatigue, weight loss because of that autoimmune factor, like your body's basically attacking your intestines. So it's pretty severe, and that's why it's very important that treatment is sought earlier than later. So it's very important to get in with a healthcare provider sooner than later because, like we mentioned, there are medications and treatments that can help improve quality of life. So it can be confusing. We have irritable bowel syndrome and we have inflammatory bowel disease. So IBS, IBD. So similar, but also very different. So just to kind of put them side by side, irritable bowel syndrome has no inflammation. Inflammatory bowel disease, you have inflammation. Irritable bowel, no bowel damage. Inflammatory bowel disease, it can damage the bowel. Irritable bowel, the lab tests are often normal. Often you can kind of go through a whole workup and the lab tests, it won't show anything. Inflammatory bowel disease, however, you can have some abnormal lab tests, such as you may have some anemia, because basically, if you're having blood in the stool, your blood counts may be low. But then some people don't have abnormal labs, but you're more likely to get abnormal labs with inflammatory bowel disease, and you're more likely to have normal labs with irritable bowel syndrome. And irritable bowel syndrome is managed with lifestyle and medication. Inflammatory bowel disease, you often require long term treatment to treat the disease when it's active, and then also to keep the disease in remission when it's calm. So, it's usually one of those things that require just more chronic treatment, more consistent treatment. So, early diagnosis matters for both because, especially with inflammatory bowel disease, early diagnosis is vital. Inflammation continues even when the symptoms seem manageable. So, without treatment, there's ongoing inflammation that can damage the digestive tract and may increase the need for hospitalization or surgery. So early diagnoses, it allows healthcare providers to start treatment sooner, to control inflammation, and help patients just have better quality of life. And today's therapies are much more effective than they were in the past. So many patients with inflammatory bowel disease, they're able to work, travel, raise families, and just enjoy full lives if they get proper treatment. So now we're going to move on to our next condition, eosinophilic esophagitis, often
Mhm.
called EOE. Right. And to be honest, it's not talked about as often. It's becoming more common just because it's being diagnosed more, but it's really not talked about as often, where many people kind of confuse it with reflux or GERD. But let's talk about eosinophilic esophagitis. So it's a chronic disease that affects the esophagus. So that's the tube that carries food from your mouth to your stomach. And with people with eosinophilic esophagitis, there's a white blood cell called an eosinophil that builds up in the lining of the esophagus. So over time, this causes inflammation, making the esophagus swollen and less flexible. And many people with eosinophilic esophagitis, they also have asthma, eczema, allergies,
Mm.
to food allergies or seasonal allergies. So, although it is associated with allergies, it is a digestive disease and it requires medical evaluation and treatment. If untreated, the esophagus can narrow, making swallowing more difficult. So, what are some signs and symptoms? Difficulty swallowing is the hallmark symptom. So, how many times have we heard people say, I have to chew my food forever? I need water after every bite. Meat gets stuck in my throat. How many times have we heard people say that? A lot, often.
Mm-hmm.
And not saying all the time that they have eosinophilic esophagitis, but it's one of those things that those are hallmark signs, and people often have difficulty swallowing. Food gets stuck. Sometimes they can have some chest discomfort, some heartburn, vomiting, and if children have it, they may have poor weight gain and growth. And like we mentioned, adults often think they just have bad heartburn when the underlying problem can be eosinophilic esophagitis. So if you know of anyone that's always saying they have GERD or just have heartburn all the time and they take all the antacids, it's just very important that they see a specialist so that they can kind of get diagnosed with what exactly is going on. Because difficulty swallowing is never normal. Some people feel like, oh, as you get older, it just gets harder to swallow. And that's not true. It should not get harder to swallow as you get older. Just treatments. So, eliminating specific foods that can trigger inflammation, oral steroid medications, or even biologic therapies for selected patients. But it's important to note that regular follow up is needed to ensure that inflammation is controlled. And although these conditions may sound unfamiliar or scary, it's important to know that many people experience significant improvement when diagnosed and treated appropriately. The ultimate goal with eosinophilic esophagitis is to reduce inflammation, prevent scarring, and help people eat comfortably again. And let's go back to our three words that we always refer to: recognize, respond, refer. So, kind of recognize if someone says, food always gets stuck, or I have to drink water to get food down, um, then you should realize that these symptoms do deserve medical evaluation. And how do we respond? We listen carefully, encourage evaluation, and also offer reassurance and always refer to a primary care provider or GI physician. And your goal is to not diagnose eosinophilic esophagitis, but to help someone take the next step. And I don't think many of us are going to say, hey, you have eosinophilic esophagitis, because that person's probably going to say, oh my goodness. But, definitely point them in the right direction. And so let's say a member says, I've had trouble swallowing meat for years. I just eat more slowly and drink lots of water. So how would you use our recognize, respond, and refer for this case?
I would say, well, you've been having problems swallowing for years. That's a concern medical alert for me. How about you ask your primary doctor how they can make that better for you? So in other words, I'm trying to get them to feel like, hey, I never experienced that, or that might not always be what you want to be experiencing all the time. Ask your doctor to see if there's something they can do about that, because that's not something you want to have to act, because that's, if you can't swallow, you feel like you're choking.
Right.
Who wants to choke?
Right.
Exactly. And choking is definitely not normal.
Exactly. I agree. It definitely can hinder your quality of life. If you're not able to swallow, that's going to lead to just unintended weight loss and just discomfort and just poor quality of life. So definitely, you should definitely refer them to a provider for further evaluation. And, as you talked about with the swallowing, some people just think that it's okay to not be able to swallow effectively because the process has probably happened slowly for such a long period of time that they almost start thinking that's just how they are. Right? Just what they do. And so it's important to help them realize like that's not a normal part of aging.
Right.
And that early evaluation and treatment can prevent complications and improve quality of life. And as you mentioned, just as your role as a health minister, you're able to help them recognize that those symptoms deserve attention and encourage them to seek care.
Yes.
before it becomes more severe. So now we'll move on to our next digestive condition, which is short bowel syndrome or SBS. And that's more rare. I don't know if you all have ever heard of short bowel syndrome, right? So that's pretty rare. That usually occurs after a person has had a part of their small intestine removed due to illness or injury. The small intestine that's responsible for absorbing nutrients, fluids, vitamins, and minerals from the food we eat. When much of it's been removed, the body cannot absorb enough nutrition or fluids. So, short bowel syndrome, it is not contagious and it's not something that people are born with, even though it sounds like when you hear syndrome, sometimes you think that may be something that you're born with or genetic, but it's often as a result of another medical condition, such as surgery, or if you have Crohn's disease and you had to get a part of your intestines removed, or if you had cancer and they had to take out that part of your intestines due to a mass, or if you had injury and a part of your intestines had to be removed. So living with short bowel syndrome can be challenging, but once again, advances in nutrition and medical therapy have helped people live active and fulfilling lives. So, what are some signs and challenges? So, there's frequent diarrhea, weight loss, dehydration, fatigue, nutrition challenges, and it can definitely just affect your overall daily life, such as going to work, social activities, and even church. So, as you can see, that a lot of the signs and symptoms they sometimes overlap. So, they have diarrhea up here. They had diarrhea with irritable bowel, inflammatory bowel. Um, Weight loss. They had that with inflammatory bowel. So that's why it's difficult to diagnose. That's why it's so important that as health ministers, we don't diagnose, but that we refer for more treatment because a lot of the symptoms overlap. And then also, a lot of times, members may not tell you the whole story for you to even make that clear picture. They might just say, oh, I keep having diarrhea, but you might not know that maybe they got shot a few years ago and they had some of their intestines removed, that they might have short bowel. And you're saying, oh, you just have irritable bowel, but they might have short bowel. So that's why it's very important that you refer them to someone that can obtain all that history and diagnose as well as treat them. So treatment and hope. Treatment focuses on helping the body absorb enough nutrients and fluids to maintain health. Some people receive nutrition through feeding tubes or IV nutrition, while others benefit from newer medications that improve the intestine's ability to absorb nutrients. The encouraging news is that many treatment options continue to improve, so that many people with short bowel syndrome are living longer, healthier, and more active lives than before. So, once again, just always encourage hope because our goal is, as we mentioned, better quality of life and just improved health outcomes. Recognize, respond, and refer. uh, so, as we mentioned, with some of the other conditions, there may be more, they're easier to recognize. Oh, the symptoms go together a little better. But with short bowel syndrome, it can be a little hard because you may not know what their history is. You may not know that they had previous bowel surgery or had cancer. So, it's important to recognize if they mention they had bowel surgery in the past, if they're having ongoing nutrition problems or just frequent dehydration. Respond, listen, encourage, offer support, and then, as we always say, refer to a healthcare team and a nutrition specialist. And churches can also help by organizing meal assistance, transportation, prayer support, or just simply checking in on someone recovering from major surgery. Um, and I know as the church, we always want to make a meal. That's kind of the way we show love and just support. But it's important to ask people, can you eat this, or what can you eat, before you make them a meal, because you don't want to make them something that may make a condition worse, especially since we're talking about digestive health. So, congregant says, after bowel surgery, I've lost weight. I'm tired all the time and I don't have the energy to come to church. What concerns you about this member?
I'm concerned about the weight loss and the fatigue and just the lack of energy. And so I would be saying, oh, sister, whatever, I'm so concerned about you since, I know you had surgery. Have you gone back to your doctor to follow up with them and share this information with them? Because there may be something they can do to help improve your energy or to increase your appetite or whatever, something like that.
Right. And we also
Right.
have to be concerned about who's at home with them, who's preparing their meals at this point, because they may not be able to do it themselves. And if they are, what is being prepared? Because you may have to have an altered dietary meal plan during this time.
That's so true. That's so true. Just those things are very concerning. Unintentional weight loss, I've lost weight, fatigue. Those are all very big concerns that should seek medical attention. It's very good that you mentioned that you're going to ask them who's preparing your meals, or do they even have the support? Because some people after surgery, they may not even have support to go back to their follow-up appointments to get the meal assistance, or the follow the meal plan that was prescribed, or take the medications that they need. So it's very important to kind of assess that support, and then, as we all know, to refer them back to their healthcare provider, back to their surgeons, to also help them get nutrition specialists if they don't have one. And of course, if they need a ride to the doctor, because they may have a barrier such as transportation, or they need help preparing the meals that were prescribed for their meal plan after surgery, going to the house to just sit with them, because sometimes after surgery you can have that just down depression, that can change your healthcare outcomes if you're not doing what you should, because your mood is depressed. And then, as always, just prayer as well, but just really providing comprehensive support for those members. So GERD, who's heard of GERD?
Oh, everything, you're all of us heard that.
I
I
think
think
we've
we've
all
all heard of
heard of
All of us.
GERD. I think we've all heard of GERD. Yep, GERD is pretty popular.
Flux.
Pretty popular, unfortunately. Most people have experienced heartburn after eating a large meal of spicy food. However, GERD is just a little more, it's basically the next step after heartburn. Heartburn comes and goes as occasional, but GERD is when it's repeatedly. You repeatedly have this reflux, and over time, that reflux, that acid can damage the lining of the esophagus. So GERD occurs when the muscle between the stomach and the esophagus becomes weak and relaxes at the wrong time. And so stomach acid can flow backwards. And that can cause this burning discomfort, a sour taste in the mouth, chronic cough, hoarseness, or difficulty swallowing. The encouraging news is that GERD is very treatable, and lifestyle changes and medications help many people, and early treatment can prevent complications. So, how many times have you heard people say, I just live with heartburn? I have it every day.
They live taking Tums.
Right. Oh, yeah, that's a big one. Pop Toms, like it's in Right. That's so true. But that's not okay. And if they haven't seen a provider, a primary care doctor, or a GI doctor, definitely recommend that they see someone, because maybe they don't even realize that there's more than Tums. There's other medications that may help them with those symptoms. So, what are some signs and symptoms of GERD? Heartburn, acid regurgitation, chronic cough, hoarseness, difficulty swallowing, chest discomfort. And so these symptoms vary from person to person. Some people may have one or two. Some people it may come and go. Sometimes you may have the heartburn. Other times you may have the cough. Many people say they have to clear their throat. And the cough is almost a sneaky one, because some people may not even have the heartburn, but I've had some people present with just a cough. Like, I just cough. I keep having this cough. And especially if they're coughing more at night, that they may think it's more they're taking Z-Packs or steroids. And really, it's reflux all along. So that's why it's very important that they speak to a healthcare provider. And then chest discomfort, as we know, that should always be taken seriously because that symptom overlaps with heart attack or cardiac issues. So if someone has new or severe chest pain, especially if they have it with shortness of breath, sweating, nausea, pain radiating to the arm or jaw, they should seek emergency medical care immediately because it could be a heart problem instead of just reflux. And so those symptoms are sometimes a little more difficult to tease out. And especially in women, sometimes heart symptoms present like reflux or just the symptoms are a little different. So it's important to refer those patients to medical to get medical evaluation very soon. With chest pain, almost emergently. If they say they're having chest pain, that's emergent um, to get medical evaluation. So treatment and hope. GERD is one of the most treatable digestive disorders. Treatment often begins with simple lifestyle changes, such as eating smaller meals. It's important to avoid eating within 2 to 3 hours of bedtime, limit foods that trigger symptoms, and also stop smoking if you smoke because that can make those symptoms worse, and to maintain a healthy weight. Many people also benefit from medications prescribed by their healthcare provider. So, yes, they have over the counter medicines, but for something like GERD, you probably need something prescribed. So, once again, the most important message is one of hope. Most people with GERD can have successful lives and their symptoms can be controlled. However, it's important for them to seek medical treatment. Recognize, respond, refer. So, recognize when someone says they have frequent heartburn, difficulty swallowing, and chronic cough. Respond, listen with empathy, encourage evaluation, and reduce stigma. And refer, of course, to a primary care physician or GI or referral network. If someone mentions food getting stuck, difficulty swallowing, or persistent symptoms despite taking over the counter medications, encourage them to seek a healthcare provider instead of to self treat. So a congregant says, I've had heartburn almost every day for 2 years. I just keep antacids in my purse. What concerns you about that?
I would think that he would have the problem probably going to progress to something even worse. At this point, you're doing this for 2 years already, and you haven't talked to a doctor, your primary doctor, haven't said, have you been to a primary doctor? Let's start there to see where he direct you to. Because if he doesn't direct you, say anything about it, he should direct you to a GI doctor.
Right. Just to get further evaluation. So it's important to recognize that heartburn every day is not something that you should just live with and accept. It deserves additional medical evaluation.
And I also think it's important for us to let them know that this is abnormal.
Right. I agree.
They might think I've had it for 2 years. This must be the way I'm going to live the rest of my life. No,
Right.
It's abnormal. Let's try to get you with some type of help.
I agree. And just imagine the quality of life dealing with heartburn every day for years or even months or weeks, just afraid to eat, or if I eat this, will it happen? Or can I lay down? Just the decisions you have to go through in your head to just think, do I want to suffer later?
Right.
And then like, is this heartburn or is it my chest? Just never really knowing how to tease out the two for so long. That's very discomforting. And so when you respond to that patient, does that member, I'm sorry, you should say, I'm glad that you shared that with me. Frequent heartburn is common, but it can lead to complications if it's ignored. So I think it would be a good idea for you to talk to someone. And then that's when you refer, encourage the individual to schedule an appointment with their primary care, GI, or, the referral network with the program.
Right. And also, we should have actually get them to start thinking about the questions they should ask those doctors. So, like, what have you eaten? Like, let's say you ate this. Did you feel like that then? Or certain things that you eat, does it make you feel that way? So when you go to the doctor, you'll let the doctor, know this is what happens when I usually eat this. So you'll know, hey, this might be something I need to stay away from. And the doctor hopefully can explain to them why.
I agree. I think it's a great idea to go prepared. So basically, almost encouraging members with any of these conditions to maybe start writing down or keep a journal. What makes those conditions worse? What makes those conditions better? Because you're not diagnosing, you're just saying, know what's going on and know the surrounding events
Right.
around it. It helps a
That's
lot
right.
if a patient can say, I get this when I do that. That helps a lot,
Yeah,
or
it does.
it helps me, if I take a Tums, I do feel better. If I don't take a Tums, I don't, that just puts it in perspective where you still need a
Mhm.
lot more information to make the whole story, but you can kind of start going down a little pathway of, okay, I need to, of what you need to get in your workup, how you need to
That's right.
handle that patient.
That's right.
So the more information that helps, and I encourage patients all the time to write it down because they say, "Oh, I don't
Mhm.
need to write it down. I remember,"
Mm.
and they don't
Mhm.
remember. They don't,
Mhm.
or when you get there, it's so much going on, you kind of just forget or you get off track.
Right.
So it's so important to just be prepared when you go because, as we know, it's not you don't have a long time, so
That's right.
you
Mm-mm.
really have to,
That's right. You got to
make
focus.
the best of it.
No,
Right? You got to
focus.
focus. I mean, you got to make the best of it and
Right.
just really, because you have to be a patient. You have to advocate for yourself. You all
Mhm.
as ministers, you're advocating for the congregants, but also it's important to encourage the congregants to advocate for themselves as well,
That's
because sometimes you're not going to be in the room.
right. Mm-mm.
They're going to be in the room. And so that's like the next step after this, after getting them to a provider, is just making sure they're prepared for that visit as well as they can be.
That's right.
And so, let's talk about just what are some myths versus some of the facts. And we mentioned some of this earlier, saying that irritable bowel, irritable bowel is just stress. But irritable bowel is a real medical condition that deserves evaluation. And then blood in the stool is hemorrhoids. Blood
Mm.
in the stool is never normal.
Abnormal.
It's never normal. Because even if it's hemorrhoids, there's something that can be done about hemorrhoids, but we don't know if it's hemorrhoids if it's never been evaluated. And even if one time you had hemorrhoids, that doesn't mean that this is hemorrhoids.
Right. And even with straining in a bowel movement, you may get a little blood if the bowel is hard and scratch against the tissue.
Right.
That could be an issue as well, but it's still worth following up on.
Get an eval. Right. I agree. I agree. You can get like a tear, but you still should get evaluated. I agree. Um, and then the myth is food gets stuck sometimes when I eat. Food gets stuck in my throat, but difficulty swallowing is never normal as well. And of course, one of the biggest myths is, "Oh, nothing can be done about it." And that's not true because many GI diseases are highly treatable. So, what are some key takeaways? So, big thing, know the warning signs. So, it's important to remember, and we've said it before, we're going to say it again. Blood in the stool is never normal.
Never.
Difficulty swallowing is never normal. Persistent digestive symptoms deserve medical evaluation, and many digestive diseases can be treated successfully. And your job as a health minister is to really help the congregants recognize these symptoms, respond with compassion, and refer people to appropriate healthcare providers. What's the three R's?
Recognize
Recognize, respond,
and
refer.
refer.
Right, recognize, respond, and refer. And so, once again, just in case, when to encourage medical care. So even though these conditions that we've talked about, most of them are not medical emergencies, there are some warning signs that we should never ignore. Blood in the stool, unexplained weight loss, persistent fever, symptoms getting worse, and difficulty swallowing. These are all red flags that should not be ignored and they deserve more attention in referral to a medical provider. And the health minister's commitment is to listen, encourage, reduce stigma, and refer. Hope matters. Many people hear the words Crohn's disease or ulcerative colitis and immediately think that their lives will never be the same. However, the reality is much more encouraging. Today's treatments are always getting better. Many people manage their disease successfully, continue working, enjoy family life, travel, and remain active in their communities. Early care changed lives, and people thrive with many of these conditions. One of the greatest gifts a health minister can offer is hope. Encouraging someone to seek care early may help them receive treatment before serious complications develop. As a health minister, you can make a difference. Thank you, and remember, say it.
Recognize, respond,
Respond
and
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 refer.
refer.
Right. Thank you all. I know that each of you will be great health ministers to recognize, respond, and refer to gut health.